According to World Health Organization, Uganda has the world's highest malaria incidence rate at 478 cases per 1,000 people per year. Malaria is also the leading cause of sickness and death in Uganda and is responsible for up to 40% of all outpatient visits, as well as 25% of hospital admissions and 14% of all hospital deaths. For years now, malaria has been the third leading cause of death in Uganda, especially among children under the age of 5 and pregnant women. However, according to the research by the Child Health and Development Center, CHDC at Makerere University, there is an increase in the death rate among adolescents due to laxity by school authorities in cleaning bushes around school premises, among others.
A very long time we kept telling people, please focus on pregnant mothers and under 5s, not anymore. We need now also the older age groups. Okay? Yeah. And therefore school health becomes so important.
The Child Health and Development Center, CHDC at Makerere University, has been conducting a study in 16 public health facilities across Busoga and Lango sub-regions. The study, dubbed Makerere Malaria Rapid Diagnostic Test Capture and Reporting Assessment, also looked at the accuracy of malaria rapid diagnostic tests, RDTs, and their reporting within Uganda's National Health Management Information System, HMIS. The study found the test kits to be promising.
So with more testing, we're able to clearly determine if a person has malaria or not. So improved on our record of people who have malaria. In the past, everyone was called malaria. Now, we only call those who are positive as malaria.
Some of the findings reveal that while there is a high level of accuracy during rapid diagnostic testing, RDTs, there were some challenges relating to staffing norms, training, onboarding, and supervision of health workers and availability of supplies at health facilities, which affected the accuracy of reporting and malaria RDT results.
Systemic weaknesses whereby the local government officials or the local government health managers fail to perform what they are supposed to perform because of the resources, lack of resources to do what they are supposed to do. Of course, the resources are not only in terms of finances, but the resources, it's a creeping problem. One resource leads to another, and another.
Behavior of healthcare workers. Sometimes they are overwhelmed with patients. So they record in the register, but when they are reporting to DHIS2, they don't record as they did in the book. So you get a difference in the results, right? Sometimes they do tests, but they report. I think the solution to these problems is supervision of healthcare workers. When you monitor them, then you ensure that they are doing things as documented in the procedures.
The search has also revealed that despite the reduction in malaria cases in the country, Uganda has registered a severe increase in malaria infection with renal injuries and renal failure.
We still report between 15 and 23 malaria deaths per week. This is reported. It excludes deaths which occur in the homes and in the informal health system. Also, severe malaria is now presenting in several forms, with people having gangrene of their extremities. Gangrene is a kind of death of parts of your body.
However, according to Dr. Arthur Mpimbaza, many people received wrong malaria diagnosis and obtained the wrong medication. He hopes that the introduction of rapid diagnostic tests has been a game changer in testing and treatment of malaria, since everybody can now do a simple test.
Many patients who would present with fever or musuja would be treated as malaria without confirming. The danger with that was many people did not have malaria and were being given medicine for malaria. So medicines were being wasted to the extent that when those who have malaria come, they don't find medicine.
The research recommends that the health ministry strengthens local government facilities with the rapid diagnostic test kits, as well as encouraging schools to enforce spraying of school dormitories.
To strengthen the local government structures, the local government generally, but in this case specifically the healthcare structures or the healthcare system, to make sure that for example, malaria diagnosis is done correctly from health center 2, where the biggest number of patients report,